As the shortage of the vaccine continues, we do know the H1N1 flu has gotten ahead of the public health system's ability to respond effectively. Delays in the production and distribution of the H1N1 vaccine has caused me and many others to be incredibly frustrated by this situation. This frustration has led to a lot of questions about the government's capacity to quickly develop and produce a vaccine when a pandemic strikes. The answer to many of these questions comes down to one thing. There needs to be, above all, a more effective and faster technology to make flu vaccines. Currently, the development and production of flu vaccine is based on a 1950s era technology that grows vaccines in chicken egg cultures. In a typical flu season, a few different strains of vaccines are developed to combat the virus most likely to be circulating. These viruses change year to year, so new vaccines must be produced each year using new chicken eggs. If a vaccine can't be produced and distributed quickly enough to prevent people from getting the flu, then it becomes all that much harder to contain the spread of the virus. More people get sick when fewer people get vaccinated. So how can we improve the nation's preparedness for a pandemic? First, we must look at alternative methods of producing vaccines, such as the faster cell-based technology.
At the very outset, let me say, this was nobody's fault. This was Mother Nature at her best. This virus did not grow well in chicken eggs this year in a system that I've likened to planting corn in Iowa. You can plant the corn the first.
In Minnesota.
Well, I say that in Iowa because actually it's the first week of May. We plant corn a little later in Minnesota. So the first week of May is when we first decided to do this virus issue. And in fact, that's when they were planting corn down there. And as a result of that, you can actually take the timing and say, well, when would they harvest it? Well, they actually harvest down there in mid-October, which is the time period that we would have liked to have had the vaccine. Well, the problem is that that vaccine didn't come through, just as the farmer who plants his or her corn can't tell you in early May what the ultimate yield will be in October. And so today we're sitting here with the kind of technology where it is that vulnerable. We don't know what we're going to get on yields, and that has been the source of this problem. We need to change that. The senator has already clearly laid out the fact that we can and must move to new technologies. It's not a matter if we want more, we have to have more. It's both a strategic and tactical question about our nation's security. Anytime we are that vulnerable, 80% of all the influenza vaccine we use in this country is produced offshore. And so we are beholden on that, and in fact, early on, some of us raised the concern that some vaccine wouldn't get here as contractually obligated because it was produced in a country that wouldn't allow it to be released, because of the fact that they wanted to fulfill their country's needs first, and that actually happened. The first doses were to arrive here from Australia and never made it because, in fact, the government of Australia kept the vaccine there to fulfill their needs. That is an example of why we have to have production capacity here.
When I met with Secretary Sebelius last week, she told me, and we were aware of this, but they've awarded a grant to a facility in North Carolina that's capable of using the cell-based technology to produce vaccines. It's expected to increase the capacity to make the vaccine by 25%, with the ability to produce 150 million doses of vaccine within 6 months after the start of a pandemic.